Welcome to the Plastic Surgery Podcast, a podcast where we talk about all things related to plastic surgery. This week, we're going to be discussing male cosmetic surgery. I am Philemon Viennes, and that is Dr. Viennes right next to me. So, Dr. Viennes, how often do men seek cosmetic surgery?
Well, women actually seek cosmetic surgery more frequently than men do. However, there's been an increase, about a 30% increase in male cosmetic surgery over the past 10 years. In fact, there have been about 1.5 million procedures performed in the U.S. just last year on men.
What is the most common cosmetic procedure for men?
Rhinoplasty, which is the reshaping of the nose. Mm-hmm. And the second is eyelid surgery to remove excess skin. And the third most common is gynecomastia surgery, where men who may have enlarged breasts would like to have a reduction.
Going back to that first point, so it is getting pretty common for men to seek cosmetic surgery.
Yes.
In the U.S. Why would men want to get cosmetic surgery? I'm guessing that it's older men want this cosmetic surgery.
It could be
surgery.
Younger men too.
Oh, really?
Yeah,
so
younger men,
like
yes.
A mix.
Yes. So in the older group, there are some physiologic changes that occur as we age at around after the age of 30 to 40. And it varies from person to person depending on their genetic makeup or any other environmental factors like cigarette smoking or any health issues that might be present that can affect the aging process. So some of the things that may drive them to have the cosmetic surgery would be aspects of work. They may feel that, from a competitive standpoint in their job position, that maybe somebody younger who may have more attractiveness as far as having to be promoted.
So what features exactly do they want when they go in for a cosmetic surgery?
Well, a male is going to be different than the female in that in a male, you want to have more subtle changes in the face, especially. The male eyebrow, for example, and facial rejuvenation is usually more of horizontal shaped eyebrow, low setting, doesn't have that overdone, lifted look like you would like to have for a woman. Some of the other areas that we look at is men typically would like to have a stronger jaw. So there are some procedures that can be performed there. They'd like to have a nice neckline and remove some of the excess skin from the face. And in the body, some of the features of attractiveness for a male would be things like more of a trim, athletic body, broad shoulders, broad chest, narrow waistline.
What procedures are used to achieve that enhancement?
So in the
those
face,
enhancements, sorry.
Right. So in the face, as we mentioned, if someone wants a stronger jaw line or chin, we typically use implants along the jaw to give it more of a lower, stronger jaw prominence. Facelifts if the patient has excess skin of the face or the neck that we want to remove the redundant skin. Sometimes we have to raise the brow a little bit just to give it more of a better appearance. Sometimes when people have excess skin of the upper eyelids, they tend to have that tired look. If a male has enlarged breasts, sometimes we can just do liposuction and remove the extra tissue that's under the breast, or that may have to be in combination with removal of skin. And then when we look at the abdomen, some men may have areas that are resistant to losing fat tissue. They may diet, they may exercise, but there's some areas that are tough to lose the extra fat. In a male, the skin is a little more elastic than the women. Many times you can achieve that with liposuction rather than removing direct skin, but sometimes you do have to remove the skin if there's not enough rebound in the skin after you do the liposuction to give you that trim look. Now, the other thing that we have to assess too is the location of the fat, because sometimes that fat, even though someone may come in with a protuberant abdomen that's bulging, they may have very little fat tissue under the skin, and a lot of that fat might be around their organs inside their abdomen, and that is an area that we don't have access to when we do liposuction, obviously, because it's deep. And in that scenario, we try to have the patient go on a diet.
Is the skin recovery better in men than women? Because you mentioned that it's more elastic.
Right. It's a little thicker and more elastic typically.
How successful are these surgeries? Like, how often are the goals of the patient achieved?
Well, some of it depends on the body shape that you are dealing with. We look at 360-degree evaluation of the face and the body, and we try to look for harmony with the rest of the body. So some people have different skeletal structures. For example, they may have more fat in certain areas. Their body shape may not be one that you can aggressively change to the shape that you're looking for, or the patient may be looking for. So that's why a plan is developed, and then discussion with the patient to determine whether or not you can achieve those results that the patient is looking for.
So it's patient to patient.
Right. It's tailored to the patient, because there are other things too that can affect the body shape, not only your genetics, but also, predisposing factors that might be there, or it could be some environmental issues that maybe the patient was a cigarette smoker, or they may have diabetes or some other underlying health condition that may not allow you to undergo some of these operations.
For any of these cosmetic surgeries, if the doctor thinks that it can be a success, they perform it, and then most of the time it would be like a success.
Correct.
Probably.
Right.
Okay. What are some of the factors that are caused by aging?
Well, physiologically, there are some changes that occur in our bodies. Protein synthesis by our cells, and so therefore your muscle mass will reduce during that time period. You tend to accumulate more fat tissue in your body. Also, there's some hormonal changes that affect your aging process, as well as your endocrine system, like your thyroid gland and your pancreas that secretes the insulin in your body. So all these factors play a role in the aging process.
The appearance issues or the biological issues that are directly related to aging are non-preventable, correct?
Well, the aging process will occur, just a matter of how quickly it occurs in your lifetime. So some of the things that people have looked at as well is what are some of the things that are modifiable in our lifestyle that can sort of slow down the aging process. I mean, part of it is the genetics, which you have absolutely no control over.
Right.
The other is if you have any general health problems. But some of the other things that you can help reduce the aging process, such as obesity. For example, obesity has been found to be associated with decreased testosterone levels, which impacts on a lot of things like muscle mass and so forth in our body. If the patient can control their diet so that they're not overweight or obese, is important. Avoiding cigarette smoking, avoiding excess alcohol. Exercising also helps as well.
Being a healthy person and an active person will decrease the aging process.
More than likely, yes.
In your body. And these surgeries aren't dangerous, right? They're not relatively dangerous. I mean, if they're performed by a doctor who knows what he's doing.
Right. Again, it comes to patient assessment and developing. I mean, there are some risk factors that are related to some of the surgeries that we do. If it's done in a safe manner on the right patient, your risk level should be low.
Right, the risk profile is low. I mean, for this, it's not like the risk profile should be low if the assessment is correct. It's not a high risk operation.
Right.
The reshaping of the jaw is an implant, correct? It's a silicone implant. Right.
Well, there are different types of implants that you can use. Silicone is one type of device that can be put in. There are some other synthetic materials that are used that are a little bit more rigid.
When you reshape the jaw, it's an implant most likely, right? That goes in?
Many times, but there are some procedures that can be done to use the patient's own bone.
Oh, really?
Yes. So you can actually advance the chin or make it longer doing a procedure called an osteotomy, which is a procedure where you actually disconnect the chin from the jawbone and you can actually move it in different directions. You can move it forward, you can move it back.
I think that is all for this week's episode of the Plastic Surgery Podcast. Thank you all for watching. Next time we might discuss cosmetic surgery again in women, right? I think we talked about that. What you called it, a mommy makeover?
Yes.
That's what you called it.
And you can call this also a daddy do-over.
Daddy do-over.